More and more people are interested in getting psychotherapy, which is great. But what most people don't realize is that psychotherapy isn't one thing. There are many different psychotherapies, and they vary widely in terms of how much science has studied them and how much they actually work. Let's say you had cancer and you went to two different doctors. The first doctor said that they wanted to give you a treatment that decades of research has shown to be the most effective treatment for your condition. The second doctor said that they don't want to do that treatment. They want to give you a treatment that they like better, but science hasn't studied at all. You probably want to go with the first doctor. And you should expect the same thing from your mental health care providers. So what does it mean for a psychotherapy to be evidence-based? When a psychotherapy is evidence-based, it's gone through many phases of testing. First, we test it in a small group of people. Then, if it's working, we test it in a bigger group of people. If it's still working, we'll test it in a randomized controlled trial where we compare it to other psychotherapies. And if it's still working, we'll test it in more randomized controlled trials and in bigger studies outside of our labs and in the real world. When a treatment is first line or front line, it has gone through all of those phases of testing, and many studies with hundreds or thousands of people suggest that it works. When a treatment is second line or third line, it's usually because the science suggests that it doesn't work as well as the first line treatment, or it's not as well studied. So when you're looking for a psychotherapy, ask your provider for the science behind what they're doing. So you don't just get a therapy, you get a therapy that works.